Hi, my name is Mason Martin, and I'm going to be doing my Pecha Kucha presentation on the opioid epidemic. While you can probably remember having a scrape on your knee or getting a paper cut, some injuries require more serious responses than just a band-aid. Opioids are a type of drug that is administered for high pain injuries or conditions and are often administered either in the form of a pill or in the form of a liquid to be injected into your bloodstream. Opioids are a type of drug derived from the poppy plant that affect the influx of pain signals within the brain. These drugs block the pain receptors within the brain so that any incoming sensations of pain will become muffled, and as a result the user will feel a sort of euphoria as well. As stated throughout the documentary Understanding the Opioid Epidemic, the issue with individuals becoming addicted to opioids in America has become a national threat. The documentary discusses real-life scenarios, the losses that happen when individuals get addicted, from families in West Virginia to Buffalo, New York, and all of them lost their loved ones to opioids, and it all started from a singular painkiller prescription. Opioids are a drug that originally was marketed as safe and non-addictive, despite the heavy effects that it gave people, but that has also become known as fiction since then. Since the 1990s, prescriptions for opioids have quadrupled, and despite annual diagnoses for chronic pain and severe injuries staying relatively the same, these drugs not only are incredibly addictive, but they are far more lethal than advertised in the original increase in prescriptions in the 90s. Opioids themselves in high amounts can cause organ failure and death, but withdrawal can also strengthen the grip opioids have on patients, as it causes severe anxiety, abdominal pain, vomiting, and many more symptoms. If opioids do their job, how can we stop them from having such steep downsides? The answer is in marijuana. Studies have shown that cannabis consumption during the withdrawal of opioids reduced anxiety and pain in those suffering severe symptoms in almost all trial patients. Moreover, those taking oxycodone for chronic pain in a study in clinical pharmacology and therapeutics found that cannabis use reduced the amount of oxycodone even required for patients to feel pain-free or at the state they were prior to testing. As though that wasn't enough, according to Yuan Shi, a professor at Cornell, statistics for those in the hospital with opioid prescriptions has decreased significantly since the passing of medicinal marijuana laws. This information alone is significant, but combined with the previous findings, I believe that it leaves little to the imagination how helpful cannabis will be in the battle against the opioid epidemic. In the end, it is clear that opioids are one of the most dangerous issues that this nation has on its soil at the current moment. Opioids are lethal and highly addictive, and have ruined families around the country. Despite this, there are possible routes to avoid this problem becoming even worse, and hopefully, our country can even fix this epidemic before it becomes a pandemic. There's my reference page. Thank you.